Good afternoon, Peter Goertz. I'm a psychiatrist. Is it a privilege to be a psychiatrist? That may sound a little strange to some people, that question, but in my opinion it is. And I'll give you some examples of why I think it is. Recently, I saw a patient who was inserting objects into his urethra, so into the opening of his penis, and he'd been doing that for years. And that reminded me of another patient I'd seen, actually it was someone else's patient I was aware of and actually observed that interaction while I was in the emergency room as an intern many years ago. A patient from jail had been brought in because he was inserting objects into his urethra. And I remember watching the doctor who was treating him and him in their interaction, and the doctor seemed just perplexed and was unsure of how to proceed with that patient. So that's an example of a psychiatrist just dealing with or interacting with people from any walk of life, basically. And another patient that, in a different way, I remember well, is a patient who I felt was ready for discharge from the hospital. I was working in a city hospital on the East Coast, and I thought the patient was ready for discharge from the hospital. He'd been homeless, traveled from the West Coast by bus and ended up on the East Coast and was not doing well, ended up in the hospital. I felt he was ready for discharge, and unfortunately, the hospital would not pay for his bus trip back home to the West Coast. So his discharge was being delayed, and finally I thought, it's not that much money. I'll just give him, he had a little bit of money, I think, and I just gave him the extra money. It might have been $40 that he needed in addition to what he had to pay for the train trip to the West Coast. And where he was living there was in an area that was very low income, a lot of homeless people in that area. And I did not expect him to send me the money back. And of course, there are pros and cons of doing that type of thing. But with that patient, I just felt comfortable doing it. And if those $40 were gone, so be it. That was okay with me. And then about 2 months later, he actually did use that money, got on the bus, went to the West Coast, back home. And about 2 months later, I get a folder, like a big envelope, and in it was a letter from him and the $40 back. So that was heartwarming for me. So another experience of a different aspect of humanity in psychiatry. And again, you see all kinds of different types of scenarios and patients. And for example, I remember a patient on an inpatient ward who had been quite violent, history of quite a few acts of violence. And I was standing with him, talking with him, and he was kind of menacing, really wanted to be discharged, kind of pushing for discharge. And I thought, oh my, maybe it's better for my safety if I discharge him. But that's really a difficult decision because of course you don't want to get hurt. And you want to really do the best you can to help patients. So it's really a balance that can be quite difficult to strike. And it can be a question, do we want to keep this patient on the ward? He might be violent to us, he might be violent to other patients. Or should we just discharge him even though really psychiatrically he's not that safe to discharge in our opinion? At that point, we did not discharge that patient. Then another patient, as an example, an HIV positive lady, a prostitute, was in the emergency room, and I was working, this is way back, I was working with another resident, and the other resident noticed that her money was missing. that she brought cash, I guess maybe, to have lunch. And she noticed after she interviewed the patient that the cash was missing. And then it turned out that patient had put her cash, the cash of the doctor, in her vagina and was trying to steal it. And the doctor got very upset. So another kind of patient that can be seen. And another thing that can happen is patients can be romantically interested in you. They may ask you out. And how do you react to that? Especially how do you react if you're quite attracted to the patient, which can be a very slippery slope. So would you want to go out with a patient? That is not a good idea. Of course, it can be tempting. That's understandable. But it's definitely not a good idea to give in to that kind of inclination if you have that kind of inclination. So bottom line, in psychiatry, you see so many different kinds of people from very different walks of life. And you get to know them quite well because they're there for a reason and they talk about their life in general. They're quite willing to talk. And in my opinion, it's a real privilege. Thank you.